Vaccination rates against the human papillomavirus are at an all-time low among Ontario youth. So this HPV Awareness Week, the Federation of Medical Women of Canada is calling on the province to address its lagging school-based immunization program, a lag that some medical professionals warn put thousands at risk of HPV-related cancers.
Our numbers were around 60% before COVID. And then because schools were closed, particularly in Ontario, and because public health was very busy with COVID, the numbers dropped to 5.2% and finally dropped to 0.8%.
And since 2021, the overall vaccination rate of students coming out of high school is about 36%. The World Health Organization says an HPV vaccination rate of more than 90% is needed by 2030, together with effective screening and treatment to eliminate cervical cancer in the next century. But it's not just cervical cancer that's a concern.
So HPV that becomes persistent, where you can't clear the virus, can lead to 6 different kinds of cancers in men and women.
HPV can be spread through sex and intimate touching, and it's estimated about 3/4 of Canadians will have at least one infection in their lifetime. But Dr. Brown says it's highly preventable with a 2-dose vaccine program. So why have the immunization rates not rebounded to pre-pandemic levels now that kids are back in school?
Often people don't know that they've missed something, and then they're not really aware of how important it is.
That's why one of the top action items the task force wants to see from the Ministries of Education and Health is better communication about the HPV vaccine, so everyone understands that preventing cancer among Ontarians is a core value.
Sometimes with government changes, priorities change, but a core value as to what is essential should stand the test of time and should be there no matter which government is in place.
The group is also calling on the province to immediately work towards implementing a unified provincial vaccine registry available to all healthcare providers, parents, and individuals. Now, the Ministry of Health did implement some changes after last year's HPV task force recommendations. We reached out to the province, but a spokesperson was not available to respond to the new action items. Michelle Mackey, City News.